Thank you all for being here. I'm excited to be here. I appreciate that you guys invited me. I want to give this talk that I've presented, that I've put together here, but I also want to open it up at the end to questions. I want to sort of know what you want to know, so I definitely want to let you know that there'll be time for that, and if you're thinking about things as I'm going along, just hold them till the end and we'll do a Q&A at that point. So today I want to basically tell you a story about what I see as a world that has fundamentally changed from the world that our grandparents grew up in. And it is a world now that is far more vulnerable to emerging diseases than at any time in human history. It's a world where some of the most remote corners of our planet, this is a photo from Sierra Leone, are interconnected with bustling urban centers of 10, 15, 20 million people. And this is a story about a world that has changed rapidly. Human activity over the last century has altered landscapes, and probably most importantly for what I'm going to talk about today, it's developed sophisticated networks of moving goods, moving people, very efficiently all around the globe. And there are competing forces out there when I look at what's happening in terms of global health and protecting people from new emerging diseases. You have, on the one hand, forces that are making it incredibly easy for a virus, some new pathogen, to get a foothold into human populations and spread incredibly rapidly. And on the other side, you've got these other forces of medicine and science trying to fight against these diseases. However, having covered this for a few years, I see that there's a huge imbalance happening between forces in our world which make it incredibly easy for disease, viruses, other pathogens to move all over the world. And on the other hand, these systems that we have in place to actually deal with that. This is the route map for just one airline. It's United Airlines, one of the largest in the world, but one of 5,000, more than 5,000 airlines that are registered in the world. And just looking at this one network of connections, and you're thinking about all of the others, and the ships, and the buses, and the trains, we have become a world that is hyper-connected. Whether we think that's a good thing or not, it's a reality. Just recently, the surge of the Zika virus across the Americas is an example of how this infrastructure has made human beings far more vulnerable to new pathogens. Zika cases first showed up in Brazil just last year, and within months, it had spread throughout most of the tropics of the Americas. According to the CDC, 20% of people in Puerto Rico will be infected with the Zika virus this year, and ultimately they expect that 80% of the population of Puerto Rico could be exposed to it. And this just shows the way in which a virus that wasn't even there a number of months ago now poses a new public health threat. And I'm going to argue that this is directly related to the human infrastructure that we have created. And it's incredibly worrying given the devastating birth defects that this virus appears to be creating. That link hasn't been proven to many scientists. Level of scrutiny, people would like a little bit more definitive evidence, but it seems clear that there is a link between Zika and these birth defects that we're seeing, which at times are fatal. Now, the thing about Zika is, it's not this virus moving on its own, wiggling across the planet, or even the vector, the mosquitoes flying with it, or birds flying with it. This is a disease that is moved by airplanes. It's moved by people who get infected in one place, might not even know that they have it, go to another place where there's a mosquito that's capable of transmitting it, and it gets another foothold in that spot. And it's taking off among populations that have no immunity to the virus because the virus obviously has never been there before. This is the new world order in which pathogens can move faster than they ever have in human history. And that's just Zika. MERS was first reported in Saudi Arabia in 2012. You know, it was simmering at sort of low levels there. And then last year, a businessman from Korea, he returned to Korea with the virus, got very sick. It spurred an outbreak in Korea that ended up killing 33 people. But it also brought life in parts of Korea to a standstill. Schools were shut. Tourism fell apart. Businesses shut down. MERS was actually blamed with a very significant drop in the gross domestic product for the second quarter in Korea in 2015. These pathogens have impacts that go far beyond just the people who get sick. We're seeing that with Zika. We're seeing that people are saying that maybe they're not going to go to Brazil for the Olympics. Global health, just like those airplanes that you see moving across the globe, these issues span out and end up affecting all of these other issues around the globe. And there have been many more diseases like this in the last decade and a half. You know, there was the SARS outbreak in 2003, the H1N1 pandemic, avian flu, the Mexican swine flu pandemic in 2009. And I would be remiss if I don't mention HIV, probably the most significant human pandemic of the late 20th century. These all became global problems because they spread, again, through our modern transportation infrastructure. And then, of course, there was the West African Ebola outbreak, which really drove home for many people the threat that these types of diseases can cause. It caused a lot of panic around the world. Many people might argue, I think with some reason, a bit too much panic. But Ebola really made people wake up to the idea that a disease in one part of the world could potentially affect people in other parts of the world, and that we are all interconnected, and that we can't allow an outbreak like that to run rampant and not come up with systems, come up with ways to deal with it. And I think one thing that's interesting is that bats were blamed for bringing Ebola to West Africa. We don't really know that. That was never definitively proven. And now, after this outbreak, we're seeing sexual transmission as a way that it moves. This is completely theoretical, but possibly it moved there through another survivor from an earlier outbreak in Central Africa who came to that part of West Africa. We just simply don't know. But now, after that outbreak, there are thousands of survivors, and there's the potential that Ebola could again move throughout the world through one of them, again, through that transportation infrastructure that I was talking about earlier. In addition to the transportation infrastructure, there are two other major forces that are pushing us humans towards a world in which we are far more at risk from emerging pandemics. And one of them is climate change. Now, this is Al Gore. I actually saw him last week giving a talk. He has been sounding the alarm about climate change for more than a decade. I don't know how I go back. How do you go back on that? There we go, back. Good. The interesting thing is he has updated his famous slideshow, which was the basis for An Inconvenient Truth, that documentary from 2006, and he's now included a whole section on the threats of disease moving as a result of changes in the climate. And another interesting thing, just this week I was reading through some different articles, which is part of what we do. We're kind of constantly looking for story ideas. And I saw that a loon in New Hampshire, that bird, the loon, had died of malaria in New Hampshire. Now, this is not the same kind of malaria that humans get, but loons basically breed up in Canada. They like the Great Lakes. They like New Hampshire. We were not seeing loons dying in the past from malaria. And clearly, we're getting pathogens that are moving further and further north as the temperatures rise. The other major factor that's making us more susceptible to what Laurie Garrett calls the coming plague is what I'm going to call the expanding human masses. And it's both population growth and it's this increased human activity. This is from a trip that I did to Peru, looking at illegal gold mining in the Amazon portion of Peru. More and more people are farming, logging, mining in areas of the world that were untouched before. This place, for instance, up in the headwaters of the Amazon, you've got miners that are going in there. They're ending up coming into contact with mosquitoes that may have been in contact with some other animal that we just were not seeing before. And this increase in human activity is only going to increase. We're currently at just over 7 billion people. The projection is that the global planet will expand in population. Human population will expand to 10 billion by 2050. Most of that growth is expected to be in India, Pakistan, and Africa. Why does that matter? It matters because we're going to have more people who are in contact with places like this, and there's going to be more opportunities for pathogens to jump over and sustain transmission in a human population. This is Malaysian Borneo. A story I did just recently was about monkey malaria in this part of Borneo. 90% of the malaria cases in Malaysian Borneo are now monkey malaria, which wasn't even considered to be capable of infecting humans a while back. It's now the majority of hospitalizations there are this form of malaria. Why is that happening? Because you've got massive expansions of palm oil plantations into areas that are inhabited by long-tailed and pig-tailed macaques. This type of activity means, again, there are more opportunities for diseases that we don't have immunity to get a foothold in human populations. Something that I've been thinking about is just when I talked about these competing forces. Basically, as populations expand, there is this pressure for more people to make a living. And our system, our economic system, has incentives for people to make more money, to cut down more forests, to plant more palm oil. And those forces mean that this expansion continues. On the other hand, these forces of people trying to deal with emerging tropical diseases, they nowhere match the forces that are out there trying to plant more farms, mine more gold. So economics is driving the development of one system, this global transportation system. Yet, when you look at what happens during the Ebola outbreak, it's clear that we do not have in place systems that are nearly as robust to try to deal with many of the emerging pathogens that could arise, or even many of the diseases that we already have here as human disease that we need to deal with. This was a grave being dug, again, that's in Sierra Leone, of a woman who had died of Ebola, and her son had actually prepped a grave right beside her house for her, and then when they arrived with the body to try to bury her, the villagers had actually filled in the entire grave because they were so worried about having a body with Ebola buried in a grave in the village. And so these guys tromped out into the jungle and were digging a new grave there. And that was sort of the solution that they worked out. And it's not just Ebola. This girl here has drug-resistant tuberculosis in Tajikistan. Now, tuberculosis has been with us since the time of the pharaohs, and probably from even before that, but we've got records of it from the Egyptian pharaohs. This girl was suffering from the disease because there are no pediatric formulations of known tuberculosis drugs for children in her country. I found it sort of an amazing example of, we know how to deal with these diseases, we know what to do, and yet children in Tajikistan who have it aren't able to get medicines that would cure them of this disease. And a lot of these medicines that we have for tuberculosis are incredibly toxic. This is another teenager in Tajikistan. She had drug-resistant tuberculosis, went completely deaf, not from drug-resistant tuberculosis, but from the medicines that were being used to treat her disease. It seems unconscionable that we are spending so much money on other things, and yet we cannot figure out a way to come up with better medicines for a disease, and leaves patients like this having to choose between being deaf or actually being dead. This is another couple that I met who both were dealing with tuberculosis, this time in Moldova. She had actually recovered. They met on a ward, on a tuberculosis ward in Moldova in the city of Balts. And he, however, had XDR TB. However, his doctors actually knew how to treat it. And there's a drug that was able to treat it. However, that drug wasn't licensed in Moldova. And thus, even though this drug exists, and even though tuberculosis can spread across borders, our solutions for it couldn't transfer back in to Moldova. And again, to me, this struck me as this disconnect between disease that can spread everywhere, and then we have international licensing of drugs in a way that someone who has the disease, who could benefit from it, isn't able to get them. And I should point out that after the story aired, and after a lot of lobbying from his wife, he was finally able to get access to the drug and was finally cured of his XDR TB. But it shouldn't be that complicated, and there are other people who are ending up in similar situations. If we are going to be prepared for the coming plague, for the next Ebola or Zika or MERS, I think there needs to be a balance between the effort and energy that gets put into all of these activities that put us at incredible risk for disease spreading all over the world. The transportation routes, the deforestation, the climate change, the increases in population, and efforts to develop new vaccines and treatments, even re-energizing the World Health Organization. We need to make sure that there's more of a balance of how do we combat these rather than so much effort being put on this other side that's creating systems that put us at greater risk. So thank you, and now I'll open it up, and I'm happy to talk about sort of this topic that I was discussing, or about our work uncovering global health in general, or about things at NPR. So feel free to, if anyone has a question. Oh, there's microphones on either side. Somebody must have a question. Thank you. Thank you.
So I'll ask you a question.
Sure, go right ahead.
That's a little long. I would just ask a question. I listened to Laura Garrett talk.
Yeah.
About a month ago, and she really condemned the World Health Organization for its kind of lack of attention to some of the details you've just outlined.
Yeah.
And as you look at the things you chronicle, you must also think there must be things that we as citizens of the United States or citizens of the world could do. What would be one or two things you would sort of suggest that we do, or what we as students or faculty could sort of push on?
Well, I mean, I think her criticism of the World Health Organization is very valid, and I think it's worth noting that we sort of expect that we have a Centers for Disease Control. We sort of expect, as Americans, that there's somebody in government that's dealing with that stuff. They've got a really cool lab in Atlanta, they'll figure things out. If something goes wrong, they've got investigators who'll get in there and figure it out for us, right? We expect that as Americans. But there really is no organization like that globally. The World Health Organization is supposed to be this international body that deals with international health crises of international concern, basically with health issues that are crossing borders. However, the Ebola outbreak illustrated that they are not capable of dealing with a major pandemic like that. And they will admit that. Even Margaret Chan, the head of the WHO, will admit it. That the organization has been underfunded. It has taken an approach of supporting local governments to deal with crises, and that was sort of its modus operandi, was to come in and sort of send in some consultants. And unfortunately, when you look at, the MERS outbreak in Korea, the Zika virus, chikungunya, all of these issues that we've had coming up recently, it's clear that it's becoming more and more likely that we are going to have some major international health crises that needs strong leadership. And the WHO is not capable of providing that. And the WHO, to some degree, is a function of what the member states of the UN have allowed it to become. And so until there's a recognition among people in the world that we need a strong public health body that looks at global issues, we sort of are getting what we asked for. But hopefully, I think there is a rising awareness that there needs to be some strong body that is going to be in charge if there's an international health crisis that's spreading across multiple borders and needs to be addressed. No.
Thank you very much for your presentation.
Come to you next. We'll get to you next. Go ahead.
Teresa Kim, doctoral candidate in Health Services Administration. I was wondering, I know that the media coverage spends a lot of time on zoonotic or other infectious diseases such as HIV, AIDS, or malaria, or now the Zika virus. With the continued refugee crisis swelling in Europe and the continued presence of Daesh in the Middle East, I was wondering also now if global health epidemics or pandemics will consider the mental health states of many refugees as they're continued victims of enormous violence, losing family members while migrating to Europe and other regions of the world, and also the continued Islamophobia that takes place when they arrive in their new homes.
Yeah, I think there's a recognition that the mental health of refugees is an important issue. I think that there has been sort of a crisis mentality where people were sort of just trying to focus on getting people shelter and food and things like that. I think there is a growing recognition of the incredible mental stress that being a refugee has on people. And I've seen that there are organizations that are out there working on it. I was in Lebanon last year working on a story about teenagers who had fled out of Syria and were working in the agricultural fields there. The services were actually fairly pathetic for them, but there were people in the area who were at least talking about it. And so obviously that's the first step, I think. Yeah. So hope that answers your question. Yeah, you, right here. Just try pushing. Is it working? No, it's okay.
I guess my question is, have you ever been infected by a pathogen you were covering? And if not, do you ever, or is that a big worry with yours as an international correspondent, traveling around the world, all that?
All right, so the question is, have I ever been infected with one of the pathogens that I'm supposed to be covering? And is that a concern? No, I mean, I take malaria medicine prophylaxis when I travel in areas where there's malaria. I'm incredibly careful, but I'm also the type of person that I want to go out and try the street food in the places where I'm visiting. You know, like I clearly have gotten, you know, some GI things, which I think that one. But I think you're thinking more about some of the other things. I mean, the Ebola, covering Ebola in the early days of that outbreak was terrifying. It was terrifying. You know, I did the first trip to cover the Ebola outbreak that I worked on. We had some other people in our organization, Fabia Quist-Arcton out of Dakar had been doing some coverage on it, but I had been in Washington and just sort of slowly seeing the numbers go up and up and up, and decided to go to Sierra Leone in July of 2014. And just to put this into the timeline context, this was before the American missionaries were infected and flew back. It was before Thomas Eric Duncan ended up in the hospital in Dallas. So it was still, you know, people were paying a little bit of attention, but it was still early days in this outbreak. And then I got there, and it was just amazing how bad it was. I mean, and I was stunned that we didn't really appreciate how bad it was till we got there. And even just I was trying to hire a driver in Freetown who would be willing to go with me for a week or two out there. It was incredibly difficult to find a local who was willing to go into some of the really hardest hit parts at that point. And while I was there, on that one, I was incredibly careful. I only ate in the hotel. You know, I didn't touch anybody. I carried around bottles of water that had chlorine in them to be constantly washing my hands. It felt at that point in time like this Ebola outbreak had something different going on. You know, we knew the basic science, we knew how it spread, but you got there and you just didn't trust any of these things that you had heard before. And in part because it was so clear that the consequences would be so high if you did get infected. So, yeah, I was incredibly careful during those things, and that's sort of how I've operated. Yeah. Someone in the back there. Oh.
Okay. Again, thank you so much. I'm an undergraduate student here, not studying public health at all. And so my question, as you're talking about when you're working in these different countries, especially with these rigorous situations and sometimes discouraging, and when we think about global health and development, I think of the post-2015 development agenda and the SDG agenda. How do we even begin to address the global health disparities when we're talking about inclusive growth and sustainable development in countries like, like the least developed economies, whether we're talking about Senegal or Lao PDR, and where these situations really don't look that encouraging or that promising to reach these goals. So what are your thoughts on that?
I mean, I agree. I think these new goals are incredibly ambitious. But I think there is probably a benefit to going with an ambitious goal rather than not laying out an ambitious goal, because certainly the original goals actually had a fair amount of impact. They forced governments to be accountable, and activists could come in and say, what are you doing on this goal? And it made people focus. I'm a little worried that the new goals may, because there's so many of them, may lose that. But I do think it was probably better that they went with an ambitious set of goals rather than say, okay, we're going to accept that this number of kids are dying of diarrheal diseases and things like that. So that's sort of my take on it. I mean, I do think that the amount of work that needs to be done also is huge. And I do also think that just making the goals elevated the discussion and sort of got people talking about some things that weren't on the table before. So all of that is good. It's all a process. And even if you set the benchmark extremely high, hopefully you will get at least close to it. Yeah. Yeah, down here. Great, great.
I just wanted to know, thank you. Was there ever a time you struggled between your role as an unbiased reporter and feeling the need to step into a situation? So.
Yeah, I mean, oftentimes you feel that way. I mean, probably one of the most difficult situations was the Haiti earthquake. I covered the immediate aftermath of that, the Haitian earthquake, and in 2010, and that was just incredibly difficult to see. Oftentimes if I'm interviewing people in some place, afterwards we'll try to give them some food or things like that we have with us. It's difficult, but I do usually come back to the fact that I think it's important that we get out the message that these issues are out there. And so even as difficult as it can be at times to see some of the situations that people are in, and this urge to try to help, I come away feeling like it is important that our audience, which is a huge audience in the US and has a lot of influence, that getting that out makes a difference. And so it's sort of, my guilt over it at times is tempered by feeling like it's important to get people's real stories about how they are experiencing some of these problems out to a broader audience.
Hi, thank you for your presentation. It was great. I'm a
Good.
staff member in the School of Public Health, and I'm also a first-year nursing student. And I was wondering, when you've gone to some of these countries, like Moldova, for example, where you see people that are facing really aggressive diseases like tuberculosis, to what extent do the attitudes there sort of reflect our attitudes that these are important diseases, that these diseases need to be dealt with? What sort of weight do they have compared to all of the other issues that these countries are facing in addition to health crises?
You know, it's it's hard to say. I mean, in Moldova, people with tuberculosis are also often shunned. And people are afraid, right? People are afraid. I don't want to end up living in the sanatorium as well. So, with that, at times, people sometimes are blaming the people who are actually infected. I mean, so we don't have it's not only in the U.S. that at times people who are actually the victims get blamed for these things. I think that in Moldova, at least the government is trying to do things. It doesn't get as much priority as probably it should, and particularly in many parts of sort of the former Soviet Union, the problem of tuberculosis there is just huge. And it's actually kind of an interesting story that the Soviet Union had a very centralized system for developing and making its drugs. And when the Soviet Union fell apart, they had these sanitariums all over the place of people who had gotten sent. You could get sent from, one part of Soviet Union to Moldova to be in a sanatorium or somewhere else. All of a sudden, the supply lines for these drugs fell apart when the Soviet Union fell apart. And you ended up with a lot of people who had been on treatment who all of a sudden it wasn't working. You had people who were in sanatoriums who all of a sudden were allowed to leave, and when they hadn't been allowed to leave before, and they went back to all these other different parts of the Soviet Union, of what had been the Soviet Union. That was actually a very interesting example of how politics ended up exacerbating a TB epidemic and probably producing, I think it's fair to say, the level of drug-resistant TB that you're seeing there is a direct result of the chaos that ensued, including disruptions to the drug supply lines in the aftermath of the Soviet Union falling apart. So, as we were saying earlier, this is all interconnected. It's not just about global health, it's about politics, it's about economics. All of this contributes. So, yeah, over here.
Hi, thanks for coming, and thank you to the deans for setting this up. I know we all really appreciate you being here. I read some of your reporting on Zika, specifically in Latin America, and I spent some time in Nicaragua last summer working in health centers, and I know earlier this last year I was floored when, I think it was El Salvador and Colombia, recommended that women just stop getting pregnant. So I just wanted to know your thoughts on that, and I guess how maybe you've observed how social norms about women and women's health has influenced the recommendations and the approaches we take towards combating Zika.
Yeah, I mean, I cannot think, I don't know, I'd be interested if anyone from a historical perspective can think about some other time when governments basically told women to not get pregnant to try to stop the spread of a disease. It's kind of unprecedented. Yeah. But it was a pretty amazing step that they took, and I think it showed just how out of control they felt. They felt that they didn't have any options, any way to really protect people. I don't know if you saw the stuff that I did out of El Salvador about women being convicted of abortion. It's a region that has incredibly strict abortion rules, completely banned in many parts of Central America. And again, so this ties in culture, into health. I'm not sure whether that is changing as a result of the Zika outbreak. I think it's just causing more of a clash than actually any change in people's attitudes about these issues. Yeah.
Thank you also for the talk.
Yeah.
I really enjoyed, especially when you started talking about climate. I teach climate. I'm an anthropologist in the department here. And we do talk about disease ecology and the impacts of how climate is going to change the movement of disease. I have a question, though, for you from maybe a slightly different perspective. Working in an environment, often it seems like it's this big overhanging dark shadow. And I'm sure, with studying disease and global health, there's that constant thought, like, when's the next big one going to hit? And I'm wondering, in the field, of course, you see people interacting, you see people being empathetic and sympathetic and helping each other out. And I'm just wondering, what sort of rays of hope do you see in some of these major health crises that help you kind of go on, but maybe don't get related out in the bigger news stories?
Well, I was just in South Sudan working on a profile of a Doctors Without Borders hospital inside one of the displaced persons camps. And one of the amazing sort of things there was so the Doctors Without Borders set up this 170-bed hospital, but the work is really being done by South Sudanese. I mean, in seeing some of them on the ward, seeing the way that they, could both charm people and get the work done, that was really inspiring to me. And South Sudan is in a terrible place at the moment. But at some point in time, Doctors Without Borders is going to leave, and all these other agencies, hopefully, are going to leave. But I felt like there's a lot of good people working in here who will be able to run those clinics in South Sudan after that. So that's usually what is inspiring to me, and the rays of hope that I see. Yeah. In the back there.
Okay, sorry. I'm an undergraduate student here studying global health. And can you talk a little bit about the role journalism has in advancing the global health agenda?
Yeah, I mean, I think it's very important that people aren't going to support something that they don't know anything about, right? They're not going to care about something that they've never heard about. So I think it's important that these issues are covered and that we get out there and let people know what some of these issues are. And also, I think that where journalism can really, really help is in making it that it's not just some person with a disease, that it's, it's this 5-year-old girl in Tajikistan who, has like this little thing that she puts in her hair, and that she's, a real person, like your little cousin or your little sister. And I think that when people can make those connections, people are much more likely to at least think that, yes, we should, maybe you're a drug company or you work at a drug company. How difficult would it be for us to come up with a pediatric formulation of that drug? That those types of connections, that kind of synergy really happens when people see there's a human behind this issue. So I think that's where journalists can really make a difference. Oh, yeah.
Hi.
Yeah.
I'm an undergraduate student who's interested in public health, and I wanted to ask you, I know you focus on a lot of stories overseas, but how do you bring those stories back to related to everything that's going on over here, and how do you maybe relate those global problems to local issues? So for example, HIV/AIDS is as much a local problem as it is a global problem.
Well, we also have our silos at NPR, and mine is that I cover international issues, and we've got other people that end up covering, domestic issues, and so it's one of our, probably Achilles' heels. But Yeah, so I'm not sure that my work always does a good job of linking back to health issues that people are facing here in the US. That said, we also have other people who are covering HIV here in the US. We've got other health people who end up covering these issues from a domestic perspective. So, but I do think that, a good story from another part of the world, even if it's not directly bringing in information and data about what's happening in the US, I think that hopefully it does make people think about these issues in their own communities. So. Yeah.
Hi, I'm Gretchen De Silva, faculty at the School of Public Health. Thank you so much for being here.
Yeah.
So you mentioned how you feel like Ebola has kind of been a wake-up call and opened our eyes to how global diseases can be. But I feel like I've heard that before, like for other outbreaks, for SARS, for example. So what do you think about Ebola is kind of different? What has changed this time around that has opened more people's eyes?
Well, I think because it's so scary. I think that's what opened a lot of people's eyes. I mean, something that has a very good chance of killing you in such an awful way, opened people's eyes. Also because there was so much media attention to it that, continued for so long. I don't know, I could be wrong on it. Maybe, 2 years from now, people won't just completely have forgotten about Ebola. But I think that it did also, having cases that were, I would like to point out, there was only one person besides Thomas Eric Duncan, who ended up in Dallas, who ever returned to the US and ended up coming down with Ebola, and that was the Doctors Without Borders doctor in New York. And he immediately went into quarantine. He didn't infect anyone else. But the fact that there were cases that were popping up in different parts of the world as people returned and whatnot, I think made people very much think about, yes, it's possible for this to spread in that way. So I don't know, we'll see. We'll see if it does have a long-term impact or not. Yeah. Yeah.
So the story you told about the multi-drug resistant tuberculosis in Moldova that I heard so clearly was that after the story broke, and you said there were other reasons, but partly at least after the story broke, the medicine was able to get to Moldova, and that just has to be so gratifying. So I am wondering, first of all, how you knew what you wanted to be when you grew up.
Okay.
And about why it's gratifying for you to do what you do.
Yeah. So I was actually an English major in college. I had no idea what I wanted to do with my life. And I ended up interning at KQED in San Francisco at the public radio station out there and just loved it. So when I was a kid, I really didn't know what I wanted to be. But yeah, I mean, it is incredibly gratifying in part to know that, Pavel is alive. He was not going to live much longer with tuberculosis if he didn't get these drugs. And it was, in one way, it was gratifying, but that exception for the drug was only for him. It didn't end up extending to other people. So there's still huge barriers out there of access to treatment. The good thing is that once one person gets it, it's more likely that other people can, but it was an individual exception that ended up just for him. Yeah, I mean, I definitely feel gratified knowing that that occurred, but I also feel gratified when I'm somewhere and somebody mentions, oh, I'd never heard of chikungunya. I had no idea what it was, and that was sort of interesting, that story you had. So I feel like this work is getting the word out about things that some people have never heard of, or understanding aspects of it that they might not otherwise. Yeah.